This is an extraordinarily rare cancer.
It's like getting hit by lightning.
There's a killer stalking an entire family.
Uncle Kenton got it first, and then my little brother, and then Mama was diagnosed with it.
I guess it kind of goes in genetics, and I don't feel good about it.
Yeah, she's progressed a lot. That's all cancer.
But now, one woman is fighting back.
We need to find some kind of answer. Maybe this will help our family in the future.
All right, do we have the laser?
She'll join forces with a surgeon to test a new weapon against this deadly disease.
Laser on.
This is experimental. You don't know what's going to happen.
Where's this sumbitch stuck?
He is the person that you want on your side if you don't want to die.
There are no proven treatments for mesothelioma. Radiation and chemotherapy would only extend her life by weeks. But there's one experimental surgery, so radical that it might just save Mary Beth and lift the curse from the entire Tate family.
My name is Joe Friedberg. I'm a thoracic surgeon. I treat cancers of the chest. They are the most lethal cancers in the world, killing over 1 million people a year. They are my life's work and worst enemy. My team and I have a new weapon in this fight. We're using lasers and a special light-sensitive drug to destroy cancer cells. We call it photodynamic therapy.
This bleeding-edge treatment has the potential to stall the cancer's advance for 5 or more years. But it's much more invasive than chemotherapy or radiation. Dr. Friedberg must crack open his patient's chest to get the laser beam to the cancerous tissue.
I believe we can help Mary Beth, but this treatment is still in the trial phase, and operations this aggressive are not for everyone.
People who come to see me for this problem are people who basically have no options. Those cancers, mesothelioma in particular, are considered incurable cancers. If you were interested, you would be a candidate for the photodynamic therapy trial. Would basically be going in, stripping the lining of the chest cavity, the part around the ribs over here. If there was something down there, I would take it out, and then we'd do this photodynamic therapy, which is what we use to treat the invisible or microscopic disease that remains even after the most aggressive operations.
We first inject the patient with a drug that permeates the cancer cells. Then, when the laser light shines on them, the drug causes the cells to self-destruct.
The goal of the surgery is to leave you with no detectable disease.
The thing that's so frustrating about this disease is that surgery alone is useless.
Chemo?
You know, I probably wouldn't give her chemo.
You can take out every trace of cancer you can see, it just comes roaring back like weeds. It's the invisible remaining cells that kill you.
Radiation might make it more difficult to do a subsequent surgery if she needed it.
Photodynamic therapy, or PDT, is a way to get tumors out by their roots. The key to photodynamic therapy is the drug we inject into the patient prior to the surgery. It gets into the cancer cells and sits there like an armed explosive. When the laser hits it, the drug absorbs the light and triggers a tiny explosion that kills cancer cells. It's critical that every cancer cell is hit with a laser light. To make sure this happens, we fill the chest with a special fluid.
You want to... We'll take good care of you. I'll see you in a little bit. You got the A-team down there today. Good. All right. We'll take good care of her.
Thank you.
All right. What's the bipolar on?
23.
Did you have that needle stick? Put that in there, kind of get a look around. When Mary Beth was diagnosed with cancer 7 months ago, it was barely detectable.
This is all cancer, all those white dots. That's all cancer.
There appears to have been dramatic progression. I'll tell you what's a shame is this stuff wasn't here in November. This is the price for waiting right here. And that's unfortunate. I hope this doesn't affect her breathing too much. I have the light people start setting up. All detectable cancer has been surgically removed from Mary Beth's chest, but we know that microscopic disease remains. This is what we hope to kill with the photodynamic therapy.
Phase 1, what we'll do is sew in the light detectors that we use to measure the amount of laser light and allows us to do the photodynamic therapy safely. Phase 2, we pour in a lipid solution, which is like having millions of little disco balls to get the light into all the little nooks and crannies. And then we'll use a laser and we'll move it around the chest cavity until each of those light detectors is seeing the same dose of light. Enough to activate the drug, but not enough to burn holes in normal tissue.
In the apex of her chest, Can you just check if it's sensing before I sew it in? All right, call this posterior sulcus. And we should just have one left, correct? That's gonna be pericardium.
4 hours into Mary Beth's cancer-removing surgery, Dr. Friedberg is ready to switch on the laser light he hopes will save her from certain death.
All right, do we have the laser? These cases are a surreal mix of classic chest surgery and biochemical warfare. Taking on a cancer like this calls for every innovation we can muster. 7's gonna be pericardium. Great. Laser on.
Lights out.
It's go time. Let's put the intralipid in.
It's coming.
We fill Mary Beth's chest with a lipid solution to help spread the red laser light everywhere in an attempt to kill every last cancer cell. So the first couple of buckets, and just kind of look through your goggles at the effluent when you suction it out. Okay. I'm looking at the screen there, and all those light sensors that we sewed in are now measuring light. We're using blinding light to kill an invisible enemy on a microscopic level. We can't see what's happening, but we know that it's extraordinarily effective. So,
Very happy.
Oh, it's good to see you. It's good to be home. I was scared you wasn't coming back. Oh, no.
It's my grandmother's birthday, and we're excited that she's home again, and we really missed her, and it's just a little party to tell her how much we care about her.
I spoke with Mary Beth. She's doing well. I have high expectation that we'll have some significant impact on this disease for her. And I hope to make this procedure less invasive in the near future. My goal is to find a way to kill these cancers without surgery.
This light is invisible, but when you shine on these crystals, you get off this blinding green light.
We're working in the lab right now on a version of PDT that uses infrared light.
The thing about the infrared light is that it penetrates much, much deeper into tissue, 15 centimeters.
This is an unbelievably exciting discovery. So using that, we hope to perform PDT without scalpels or blood.
This is huge.
If genetic research helps us detect these cancers earlier, we'll really be poised for a leap forward. I'm very optimistic about the future. Mary Beth's descendants stand a better chance than her ancestors of surviving this cancer.